We will go ahead and begin today's webinar. We appreciate everyone who has joined us. Just to reintroduce you to the group, again, this is the Executive Policy Group of the Emergency Leadership Team, and we represent sort of the strategic planning committee behind the university's emergency response efforts. And what we've been focusing on for the last several months, of course, has been the pandemic, and we've been doing what have become these weekly webinars to keep everyone updated on the efforts and the protocols as they continue to evolve. So I will introduce our team. Myself, I'm Teresa Powell, Office of the President, also a member of Executive Policy Group. Dr. Jackson, if you'll introduce yourself.
Hi, I'm Ruth Jackson, Vice President for Academic Affairs.
And Chief Holland.
Hi, I'm Chief Mario Holland with Langston University Police Department. Good afternoon.
Dean Busby.
Good afternoon, Joshua Busby, Dean of Students.
And Dean Snavely.
The other Josh, Joshua Snavely, Dean of the School Business.
So again, we represent the Executive Policy Group of the Emergency Leadership Team. So we're going to be coming to you on a weekly basis to provide some updates on all of the efforts behind the scenes and the communications that you can continue to receive and expect from us. We're going to just keep the conversation going, and we will make some time at the very end of today's webinar for some question and answer. So stay tuned for that. I do want to also just kind of share the topic of today's webinar. We will be going over the revised plan for a healthy and safe return to Langston University. We decided to focus on a topic each week to kind of break down the amount of content that we're bringing to you, because we know it's a lot of information each and every time that we're in front of you. So we want to make it a little bit more palatable as we go forward through the semester. So today we will be focusing on the plan. We'll be sharing the plan. It is newly revised and will actually be published tomorrow, September 1st. So we're very excited to share it with you. It is relatively maintained all of its content throughout its first publication. That was June 1st of 2020. It's when the plan first premiered on our COVID-19 resource page. By and large, it is the same, but a lot of the content within the plan has evolved as necessary to effectively respond to the pandemic and to align with the evolving guidance from the CDC and other local, state, and federal health organizations. So just keep that in mind, that this is sort of a living document. It is a document that will continue to change and evolve as needed. So I'm actually going to share my screen, and I'll do that now so that we can take a look at the plan together. All right. So here we go. Again, the EPG is bringing this to you on a weekly basis, and I'll just give an overview here of what we'll talk about today. We'll begin with the COVID-19 update. We'll focus on sort of what the status is locally in the vicinity, as well as at our university and around the state as well. Then we'll go into an overview of the revised plan itself. We'll be sharing that plan with you so that you can take a look at it with us in real time. And then we'll have a discussion which will include our Q&A. So first up, just want to give an update on where we stand with the cases. You'll see we have it broken down here statewide, the local vicinity, Logan County, as well as on the university level. So we are continuing to monitor this on a daily, if not hourly basis. We get updates throughout the day from the state health department that we continue to watch and monitor. We're in contact with local and state officials as we continue to monitor these numbers. We do see some increases there, but what's not on the screen that we're also paying close attention to is the increase in recoveries, which is also very encouraging. So we continue to watch those numbers as well. You see on the screen here that the cases have increased throughout the state, and also we are seeing cases, of course, in the local vicinity in Logan County, far less in Logan County than other places within the state. And then just to kind of break it down to you even further, the cases, total cases at Langston University, that's total, and then the total active cases. And these are individuals that may or may not be on our campuses currently, but we are certainly monitoring the number of cases. And now we're going to move into the plan itself. And this may be a little bit difficult to follow, but again, this will be published tomorrow. So be sure to watch for it on our COVID-19 resource page. We will be publishing this so that everyone can read it thoroughly. It's a little smaller on the screen for me, so I hope that everyone's able to follow along. I'll try to see if I can zoom in for us. But we are premiering this new revised plan, which we're calling Protect the Pride. So you'll see this branding throughout the plan, and we'll start to use this lexicon as we move forward in sort of the revised language within the plan and the revised protocols. So you'll start to see us make a shift from the plan for a healthy and safe return, which is the subheading that you see there. We'll start to refer to it as Protect the Pride. So you can continue to watch for updates surrounding Protect the Pride as we continue to move forward together. And you'll see within the plan, of course, we have the executive summary, which has we've maintained throughout the numerous publications and revisions of the plan. So again, a lot of this remains unchanged. Our 5 guiding principles remain unchanged. And what we're going to do today is actually move through those together. And our first guiding principle here, you'll see the 5 here on the screen, is promoting healthy behaviors. And Dr. Jackson will be sharing more with us about that principle. Dr. Jackson?
Thank you, Mrs. Powell. Hello, everyone, and thanks for joining us again for our weekly webinar. I hope that you are finding these webinars informative and supportive as you continue to move through this remarkable semester. So the first principle, promoting healthy behaviors. Our first guiding principle is viewed here. So this portion of the plan really emphasizes the behaviors that will help reduce the spread of COVID-19 in our community. We must all do our part to keep ourselves and each other safe. I have to say, I have been very encouraged when I look across our campus and notice how many people really are taking these steps to protect our pride. We encourage everyone to continue practicing the behaviors that are outlined in the plan, specifically hand hygiene. Wash and sanitize your hands frequently. Utilize the sanitation stations that have been deployed across the campus. And remember that sanitizer is not a replacement for hand washing, but something that you should get into the habit of doing each time you see one of the sanitizing stations. Secondly, respiratory etiquette. Remember, make sure you cover your coughs and sneezes and continue to wash your hands frequently. You'll see the signage, and we're asking that you continue to adhere to the signage and messaging. You may have noticed signage across our campus that encourage our community to mask up or stay at a lion's length apart. We'll continue to communicate in a variety of ways, including this weekly webinar, our university emails, as well as additional signage across the campuses. Chief Holland will now share comments on maintaining healthy and safety protocols.
Thank you. And good afternoon, and thank you for joining us again today for this webinar. And for this portion, what I will cover with you all is I'll acknowledge the plan. I'll also discuss the mask and face coverings, monitoring for symptoms and notification protocols. So for maintaining health and safety, the second guiding principle are those protocols, maintaining health and safety. This portion of the plan covers the protocols in place to keep our community safe throughout the pandemic. The critical protocols in this section includes, as discussed, the plan, mask and face coverings, make sure to monitor your symptoms, and notification process for reporting exposure and symptoms, and finally testing. So acknowledgement of the plan. So effective tomorrow, September 1st, all members of our community will be required to submit an acknowledgement form indicating that they have read the plan for health and safe return. The form is a simple acknowledgement that you have read and understand the plan. A QR code also has been included in this plan for convenient access to the form. For mask and face coverings, if you have been to any of our campuses, you should see signage indicating that mask or face coverings are required in areas where social distancing is not feasible. We cannot emphasize the importance of masks and face coverings. Wearing a mask protects others and helps us to slow the spread of the coronavirus, COVID-19. Our faculty and staff are working to model the behavior with the use of masks and face shields. Now we'll talk to you about monitoring for symptoms. Part of the personal responsibility we all must commit to in the ongoing pandemic is to monitor our health. For the majority of people who have COVID-19 symptoms were mild and similar to the flu. So you have to be mindful of your overall health. Pay attention to signs of shortness of breath or trouble breathing. We encourage you to review the CDC guidance regarding symptoms as the information is regularly updated. If you are experiencing symptoms, stay home. Contact the emergency leadership team for further guidance. We have a reporting mechanism in place for those who are displaying symptoms or who believe they are exposed. Now I will share with you the steps, the notification steps following the potential exposure and symptoms. We introduced the notification process last week during our weekly briefing webinar. Members of our community who believe they have been exposed to COVID-19, who experience symptoms and/or who test positive, should use this process to notify the appropriate university entities. This is an important component to the plan, as it allows us to collect information needed to conduct appropriate contact tracing and provide the best guidance. There are 5 steps in the notification process. Number 1, stay home. Do not report to work or class in person for 14 days from the date of exposure, if known, or from the first day you experience symptoms. Consult with your healthcare provider. Avoid public places. 2, notify appropriate university personnel within 24 hours or as soon as possible. Students, make sure to contact the health clinic or Dean Busby directly, and employees, make sure to contact your immediate supervisor. Number 3, make a list of your close contacts. Close contact is being within 6 feet of another person for more than 15 minutes, or being in direct contact with respiratory droplets of a person with a confirmed case without PPE. Being coughed or sneezed on would be an example of this. Number 4, make a list of spaces on any Langston University campus where you have visited with emphasis of the following: spaces where you did not wear appropriate PPE, like a mask; spaces where you spent more than 15 minutes at one time, even with appropriate PPE; and spaces where you touch surfaces extensively and repeatedly. Make sure to submit the notification form containing all the aforementioned information to the emergency leadership team. This form is the official notification mechanism, and it helps us to conduct contact tracing. The final protocol is testing. At this time, the CDC does not recommend testing as a required protocol to return to work or school. Test results reflect only a snapshot in time. The university will continue to make referrals to external providers for testing. And with that, I will now pass it to Dean Busby, and he will share comments on ensuring healthy environments. Thank you.
Good afternoon, everybody, and thank you so much for joining us again. Always a pleasure to get to I don't want to say stand before you, but sit before you to present on our weekly updates. And so thankful to be able to bring you this information. And so my comments will be regarding ensuring healthy environments. And this portion of the plan, of course, is entitled Ensuring Healthy Environments. Focuses on the ways in which we are making our environments safe, essentially the general community safe. And so the plan includes details on cleaning protocols. And then what you see there is a clear, defined definition of what cleaning means, what sanitization means, and then also what disinfecting means. And so I think that it's very important to be able to see that, and obviously not going to read that to you, but for you to be able to see exactly what is defined and what the expectations are around cleaning, sanitizing, cleaning, sanitizing, and disinfecting, right? And so our partners with Sodexo facilities have worked to ensure that their cleaning products and procedures meet the necessary standard to neutralize the virus in every way. You will see that the plan continues and contains those definitions for each one of those strategies. And then we also have, of course, the detail of the layered approach, and you'll see that there of the layered approach to cleaning, sanitizing, and disinfecting the spaces. And what we want to commit to you and what we have already been doing is that our teams have been cleaning the high traffic areas on the regular, okay? Moving into communal spaces, communal spaces have been closed and or they are modified to promote social distancing. I'm sure if you've been on the campus, you will see that a lot of gathering spaces that we've had in the past are not open or accessible at this time, or it has definitely been modified to promote social distancing, meaning that there's less, a smaller amount of essentially bodies that would be available or allowed in that space at one time. As it relates to food service and dining services, that we've already deployed our modified operations to promote safe and a healthy delivery of meals. All precautions are continually to be taken. We will have a future webinar to focus on dining and all the safety strategies that they are employing as well. But just for now, we wanted to definitely give you a peek under the hood, if you will, relative to all the work that Sodexo Dining has been doing. Moving on to modified class and office layouts. Those of you on our campuses have likely already noticed the modifications which has been implemented in classrooms as well as in offices. We have taken all types of measures to maximize social distancing around our campuses. We are offering a variety of course modalities. Of course, Dean Snavely will share more on that in a moment. But as it relates to modified arrangements for our employees, the plan includes detailed modified staffing arrangement suggestions for both faculty and staff to ensure social distancing. And it's our hope already that supervisors, department heads, chairs have already had that conversation with their teams and beginning to implement what that strategy is. The emergency leadership team worked closely with all the area supervisors to help create those plans. And so staffing modifications, as we know, are ongoing and will continue to evolve as needed. As it relates to physical barriers, guards, and guides, throughout our campus, we have, of course, installed a variety of barriers, lectern guards, and stanchions to direct social distancing, especially in high traffic areas. You'll see that, especially those stanchions, you'll see them in the great room as you come in to get your meal. If you've been in Page Hall, you will see them in front of Student and Employee Services. You'll see them outside of the office of the registrar. You'll see on the second floor outside of the Office of Financial Aid. And so we have those and have deployed those all over campus, again, to help us to direct and maintain social distancing. As it relates to shared objects that are shared in office and classroom spaces should be properly cleaned and disinfected. Our facilities teams have been attentive to these items. However, we must all take personal responsibility as well when we are in these respective spaces. Cleaning supplies should be available in every classroom for our faculty members and are also being deployed within offices. So be sure to disinfect shared objects when you can, however you can. As it relates to ventilation, our partners in Sodexo have a great deal of time, have spent, a great deal of time reviewing our ventilation systems to increase circulation and to promote filtration within all of our spaces on campus. As it relates to water systems, Sodexo is also working to ensure that our water systems remain safe. They are safe, but they also will remain safe. That also includes disinfecting water fountains or even disabling them where that is necessary. Once again, we want to always remember that safety remains our top priority. And that is why all of these protocols that I've spent a few moments with you reviewing on this evening are in place. At this time, Dean Snavely will now share comments on sustaining a healthy operations.
Good afternoon. Glad to be with you again today. I view our plan a little bit like I know some of our coaches approach the games in which they play, that they're constantly being updated. The plan that you start a game with is not the plan you go into the fourth quarter with. And it will truly take all of us as players and members of this team looking at these plans often to ensure that they're meeting our needs at the time. So the plan we started with in June is now different based on the circumstances, the data, and the science we face today. And so it's really critical for all of our community on a regular basis to be looking at these plans and seeing how they've been modified to face the circumstance of the day. One of the big items that Dr. Jackson has addressed in prior webinars and addresses is how we built the coursework schedule this fall to ensure that layered approach that Dean Busby referred to. So these academic modalities or course delivery methods are designed not just for convenience, but to truly mitigate and change the way in which we delivered on our core mission here at Langston. And if you've been around the campus in classroom buildings, you'll notice a difference. There is far less traffic. That is by design. And that is implemented and made possible by particularly the hybrid and the flexible course modalities that you see there in the plan. That is what Dr. Jackson and the deans designed the system to be, is to allow us to deliver on our mission, but to do so in a way that doesn't have as many people in these spaces as we would traditionally have. So know that if you're just coming on to classes, another reason we're doing this plan webinar today is Friday was the add drop period for 16-week classes. So we know some students have joined us over the last couple of days. We brought on new faculty, so some of this might be new to many of you. So again, those modalities are designed to enable the maximum amount of flexibility for both the faculty member and the student. Access to campus, Chief Holland spoke about this last week. Here is where you'll find the link. If you have a visitor, vendor, or someone who's not authorized to be on campus, you will utilize this link to be able to get them access to the campus. So the main form of verification for campus access right now is a parking decal, a current 2020-2021 parking decal. If a person does not have one of those and needs to access the campus, they should follow this link and complete the form, and it can be authorized by the ELT to be on campus. We, the ELT and the EPG, continue to be the designated point of contact. So as you experience issues that aren't addressed by the plan, or you need clarity, utilize that LUELT account in order to do that. General rule of thumb, the rule of 10. So whether that's events, gatherings, meetings, no event, gathering, or meeting on this campus should exceed 10 persons unless approved by the emergency leadership team. So we're doing that consistent with the CDC protocols to ensure that we're keeping social distance and reducing the likelihood of of social contact and close distance among the persons. So just keep that rule of 10 in mind. Only other piece I think here that's new that's worth just mentioning is that we are continuing our travel and transit freeze for academic and business purposes. If you have some sort of grant or specialized reason to travel, you should consult your supervisor and ultimately the Office of the President in order to facilitate that. Again, direct all visitors, vendors, and volunteers through the access process. Those are the main updates on the sustaining healthy operations piece. So with that, I'll turn it back over to Ms. Powell to finish out the plan piece with our resilience and resilient community section.
Thank you, Dean Snavely. Yeah, this portion of the plan has remained intact throughout the several revisions because we do want to focus on the resiliency of our community. And you've heard us say it before that we're not short on resiliency. That's something that is natural to us at Langston University and something that has taken us through adversity in the past and will continue to do so beyond COVID-19. So this portion of the plan, we're really focusing on the strategies that we will use to respond to those who are directly impacted by COVID-19. And that's beginning with the accommodations process. If you joined us last week, our weekly webinar was focused in part on this very topic. We had AVP Buckley join us and we talked through the accommodations process. If you need a medical accommodation for COVID-19, you should consult with Student Employee Services. There is a process in place for requesting an accommodation. There's a process in place and a mechanism for approving those accommodations. So it's really important that if you and your physician agree that you need an accommodation for medical reasons, please don't hesitate to reach out to Student Employee Services so that we can get you those accommodations in place. Moving on with resiliency, we have expanded this portion of the plan slightly to include isolation as well as quarantine. So again, in response to those who are directly impacted, the university has identified space for isolation and quarantine, as well as a process for doing that. And should anyone need self-isolation or quarantine, that decision is made in consultation with the EPG, housing staff, and our medical personnel within the health clinic. So those decisions are made on a case-by-case basis, and we are following CDC guidelines to ensure that the 14-day period is observed so that we have everyone remaining safe if they are self-isolating or if they are in quarantine. One other item that is new that the CDC actually just recently released is regarding exiting from quarantine or ending quarantine. The CDC recently published some guidance saying that they do not recommend a test in order to be reintroduced to the community. So we're following that guidance. If you complete the quarantine or the self-isolation period and you are symptom-free and have been symptom-free for those 14 recommended days, then we're going to follow that guidance for reintroduction into the community. We want to draw attention again to support and coping and counseling. That is so important, not just for our students, but for all of us, just to remain focused on our emotional and mental health throughout this pandemic. It is something that many of us have found to be mentally exhausting just for all of the gauntlet of information that we're wading through every day, not the EPG, but everyone. So we're all kind of bombarded by news and different information that we're having to process. So just make sure you're taking the time to take care of yourself. I want to also just draw your attention to the appendices in the plan before we move on to some closing remarks by Dr. Jackson. So as you view the plan, again, it'll be released tomorrow. You will find the appendices that were in place in the revisions. We've added to those as needed. So certainly make yourself familiar with those, including the membership of the EPG, ELT, and our advisory group. It's a very large list of people who have helped put this plan together and who are helping our operations move forward each and every day. And we really appreciate their input and their creativity in helping us to execute on these plans. The timeline for return, of course, we're past August 3rd, and we're still focusing on the staggered work rotations and the staffing accommodations that Dean Busby mentioned. That is still in place and will continue to be in place as needed. And finally, this is the guidance form for accommodations. Again, if you tuned in last week, you heard Mrs. Buckley, AVP Buckley, speak on this very topic of accommodations. So please make sure that if that is needed, you follow the guidance in this form. It's going to be part of the plan, but it's also available on our COVID-19 resource page. And please be sure to reach out to Student Employee Services and get those resources if they're needed. And now we will just have a quick announcement before I turn it over to Dr. Jackson for some final comments. Our next webinar, Monday is a holiday, so we will not be meeting on Monday, but we will meet on Tuesday. And that's a typo there. I'm sorry, that's not 4 p.m., it's 3 p.m. So we'll make sure to send out some communications to that regard. But our topic will be cleaning guidance and strategies, and we will have a special guest from our Sodexo team with us next week. Dr. Jackson, would you like to close us out with some comments?
Sure. I would just like to say how much we appreciate all of you, students, faculty, and staff, for joining us again on this Monday afternoon. We appreciate your time and your attention as we walk through our plan together. I want to emphasize again the importance of the acknowledgement form that was shared. This acknowledgement form will be available beginning tomorrow when the revised plan is published. So this form needs to be completed by everyone in our university community, students, faculty, and staff alike. So please make sure that you refer to, I think it will be on page 14 of the plan, and use the QR code to complete the acknowledgement form. If you have any questions about that, as always, feel free to reach out to the LU ELT with questions. So before we address questions that are in the chat, here are a couple of reminders. We want you to continue to monitor your Langston University email, as well as our COVID-19 resource page for the most current information. And again, please send any questions or comments that you have to luelt@langston.edu. So thank you. And we will now answer any questions that are in the chat.
Looks like there was a question. Hopefully everybody could hear us. Looks like there was a question about the sound. So hopefully that was worked out. And I see there was a note about some missing cleaning supplies. We'll make sure to follow up with Sodexo on that. That's no problem at all.
The question around how to deal with students who potentially may come to class, or could be staff as well, displaying symptoms or having issues sort of around that area. We would encourage you to have a frank conversation with anyone displaying symptoms of COVID-19 and ask them to return home. You're welcome to engage your department chair or your dean or the LU ELT, but anyone, it is within the power of instructors or supervisors to ask someone who is experiencing or displaying symptoms to take a day and go get well. And we're certainly here to support those kinds of requests if for some reason someone was not compliant, but would recommend you talking to someone. We've tried to build a a layered approach that allows any student to attend the class, with maybe the exception of a few lab courses, where they can do that synchronously or asynchronously through a recording. So there shouldn't be a circumstance by which a student wouldn't be able to get the material, even if they weren't feeling well that day. A faculty or staff member can also utilize the notification form. If they see someone experiencing symptoms, you can fill it out on someone's behalf, and we can initiate the process to check on that person as well if someone has concerns.
Related to that, we've also received a handful of accommodation requests from students. So those of you who teach students who have requested these accommodations, you'll receive a letter or a communication from Mrs. Buckley in the same manner that you generally receive ADA accommodation letters. So we encourage faculty to work with students and help them understand that, you know, our intent is not to penalize them, but rather, as Dean Snavely said, to utilize the structures that we've put in place to accommodate students who may have to physically miss class.
I don't see any other questions. If you have questions, please feel free to add those to the chat, or if you don't feel comfortable doing so, you can always send an email to luelt@langston.edu. We'll be happy to address that in that manner as well. And I see there may still be an issue with the sound. I'm not sure what is happening there, but
This spout looks like Brooke has her hand up. I don't know, Brooke, do you have a question or? If you do, feel free to go to the chat, Brooke, if you do.
okay, well, we are just at about the 40-minute mark. We've been trying to keep these to about 45 minutes. I see that a question just came in about sanitizing spray. Absolutely, we'll make sure that we get that over to Hamilton. And Dr. Johnson, Wi-Fi, we are doing a Wi-Fi assessment in the very near future. We are working with Oklahoma State University on that effort. So we will be working to identify any areas of concern, but we appreciate you letting us know. The ITS team has been working hard to find and resolve any issues that are currently existing on the campus. And we'll make sure to, are you in Jones Hall, I believe, Dr. Johnson? We'll make sure.
Can I add, Dr. Johnson, if you'll send an email to the LUELT with the rooms that you're in, we can also try to connect the CTU with Ethernet connection instead of Wi-Fi, and that might prevent some of the issues. So if you'd shoot us an email, we'll troubleshoot and try to see if we can find a solution around the Wi-Fi in those rooms. And again, just sort of a note, I think I've said this on other calls, but this is the first time in our history when we've simultaneously used this much Wi-Fi at one time, both in the classroom and across the housing units. So far, our bandwidth speed is holding. I won't get too nerdy on you. My other panelists will cut off my sound. But So we're looking at some of the other issues, but for the most part, our bandwidth project, which was led by some of our colleagues a couple of years ago, has really made a difference. But we're troubleshooting issues here and there, and often our issues result from a loss of power as a result of storms, and so those require manual resets. But all in all, I think most of our Wi-Fi issues are being resolved whenever they go offline. But just know that this is this is a part of a transition that we've never undergone, and so it's going to take us a couple of weeks to make sure we get those kinks worked out. But we're constantly working on it. We have at least a weekly call just dedicated to technology issues, and then we typically bring up technology on our daily emergency leadership team calls just to make sure we're all on the same page. So.
And just as a reminder, we will publish this recording of this webinar. So you'll be able to find all of our weekly webinars on the university's YouTube page. We publish them all there. And we also will link all of them on the COVID-19 resource page. So we try to send out communication once that's complete so that you have a direct link to the recordings. But when in doubt, always check the COVID-19 resource page. And you can always check the university, the Langston University official YouTube page, and that's where we will publish all of our weekly webinars as well. The new computer units. Ms. Henderson, are we talking about the CTUs, the classroom technology units? I think that we can arrange for that training if needed. Our colleagues in CTI and ITS have been helping us with those, as well as Dean Snevely, so I'm sure that we can arrange for that. That shouldn't be a problem at all. For new faculty, absolutely. All right, and we're just at the 45-minute mark. We've been trying to keep these about 45 minutes because we know your time is valuable. So again, if you are interested in watching the webinar at any time, any of the weekly webinars, we will be publishing those. Next week, as a reminder, the webinar will be on Tuesday, so enjoy your holiday on Monday, and we will see you Tuesday at 3 p.m. We will send out the communication of how to access the webinar, so please be monitoring your Langston University email for that communication, and we'll make sure to send that out to get you all connected. And thank you again for joining us, and we will see you again next week.
Good evening, everybody. Thanks so much for attending.
Thank you. Good night.
Thank you. Have a good evening.